The SWOT study is a prospective observational study that is, the abbreviation means Shock, Whole Blood, and Assessment of Traumatic Brain Injury. And it is a prospective observational study using the LIGHTS network.
The LIGHTS network is a network of trauma centers across the United States, now numbering more than 40 trauma centers, funded by the Department of Defense with the purpose of conducting studies to improve trauma care in the U.S.
The key findings of the prospective observational SWOT study are that whole blood, when we use it in patients at risk of hemorrhagic shock, and those patients that are going directly to the operating room for hemorrhage control interventions, whole blood was found to be safe. And in a subgroup of patients that as their predicted risk of mortality increased, whole blood was associated with significant survival advantage.
Whole blood has all the components that are necessary in a hemorrhaging patient. It has platelets that help initiate the clot. It has plasma that has all the necessary proteins to help keep the clot and sustain it. And then lastly, it has red blood cells that carry oxygen to the tissues.
It provides that early and upfront in the emergency department, and probably provides the most bang for your buck for trauma resuscitation.
Whole blood in this particular study was just applied to trauma patients in the emergency department. What we hope to do in the near future is to start randomized clinical trials where we are able to provide that whole blood earlier.
And it may be that whole blood, when it's given early in the emergency department or in the pre-hospital setting, may have its greatest survival advantage.